Among hospitalized patients, urinary catheters can stay in place for a long time. And the longer catheters stay in, the more chance you're giving for bacteria and yeast to grow in that culture media and move upstream. There's the risk of urinary tract infection, of course. Then, too many antibiotics. Prolonged hospital stay. Occasional bacteremia. Now, many docs simply aren't aware of which of their patients still have catheters, or aren't thinking about them, unless the question is asked head on.
PICC line is out. What about the foley?
He does not have a foley.
Here it is! Yes, he has a foley.
It is supposed to be below the level of bladder, so the old urine does not reflux backwards.
Now that we've established the fact of the foley, what's it doing there?
Well, we should keep it for input and output. We're still diuresing, so.
Yeah, maybe we can keep it for one more day.
Is there no other way of measuring response? What about symptoms? What about clinical exam? And if you must measure the output of urine, is foley the only way?
Mr. Jones, you could use a urinal, right?
Oh, sure. Just don't put the urinal next to my jug of ice water. Wouldn't want to mix the two of them up.
Diuresis does not necessarily require a foley. Think of safer alternatives. Don't just leave those foleys in forever. Get rid of some today. Urinary catheters are way overused in hospitals. It seems like everybody has one. Yeah, sure, they're helpful for obstruction, measuring every drop of urine in a critically ill patient. But let's face it, some of it is just plain convenience.
Oh, could I please have a foley? You know, they are so convenient. And I'm so tired. I don't want to have to get up and go to the bathroom.
Yes, I know they're convenient, but that doesn't mean...
Could you get me 5 foley kits, please? All my female patients are diuresing simultaneously. I don't think I can handle it. They all need foleys.
How come no one is helping this nurse? Why are we going into the medical library study area? Oh, brother. I see. Sure helps manage the caffeinated fluid diuresis. But this is thoroughly out of control. Each day that a urinary catheter is kept in place, the higher the risk of bacteriuria, the higher the risk of infection. Catheters quickly become colonized, encrusted, teeming with organisms. By all scientific measures, they're gross. Good move. He's going to get that catheter out ASAP. Hey, don't forget to deflate the balloon. Convenience for patients, for nurses, or for medical students is simply not an indication for catheterization. Avoid using those gross catheters. Now for some tips to get through your day. For your patient who wants the catheter for convenience, discuss the downsides. Each day those catheters are in, the greater the risk of infection. Urine infections just aren't worth it.
Ooh, I had no idea about that infection issue. Let's forget about the foley.
When possible, offer non-invasive alternatives. Ask the gentleman if they can use a urinal instead.
Cheers!
And yes, bedside commodes are good.
Oh, thank goodness, that's exactly what I needed. Thank you.
You're welcome.
Instead of indwelling urinary catheters, there are very often much safer alternative strategies. Don't impose unnecessary infection risk with unnecessary, gross catheters. In hospitals, urinary catheters are used left and right. Everywhere you look, there's a urinary catheter. What's the big deal, you may ask? Well, they are unnatural and invasive. They're clumsy. They interfere with mobility.
Ow!
And worst of all, catheters are culture media for bugs, bacteria, yeast, you name it. They can be disgusting. Really? You want one of those stuck in you? Now, I have a much better idea for you. Do you still need to measure urine output in your patient? Take a look at this. As compared to an indwelling Foley, these are so much safer, dignified ways of measuring urine output. Urinals and bedside commodes are great. Avoid those catheters.